Years old woman is a passenger in a car during an accident. Her knee hits in the dashboard. On examination, tibia looks posterior. Tibia looks posterior compared to non-injured knee. What structure has been injured? So a patient or a person who is 34 years woman is a passenger of car during an accident, and her knee hits the dashboard. Here the options are the anterior cruciate ligament injury, posterior cruciate ligament injury, medial collateral ligament injury, lateral collateral ligament injury, and patellar tendon injury. So what may be the option here? The tibia looks posterior compared to the non-knee, which is the positive of posterior draw test. Here we can see this is the menisci of the both side. This one is the lateral collateral ligament and this one is the medial collateral ligament, and here we can see this is the posterior cruciate ligament and the tearing of the posterior cruciate ligament. Here we can see this is the PCL tear, that means the posterior cruciate ligament tear. So rupture posterior cruciate ligament mechanism due to hyperextension of the knee joint. It occurs due to hyperextension of the knee joint injury. Tibia lies back on the femur and it is called the posterior draw test. So tibia lies back or tibia lies posterior to the femur, and this condition is known as there is positive posterior draw test, and also known as the paradoxical anterior draw test. So here we can see this is the posterior draw test positive. When the tibia is given backward, it goes backward from the femur, so it is the posterior draw test positive. So when there is tibia look posterior, that means the posterior draw test positive. In this condition there is the posterior cruciate ligament injury, and in case of the anterior cruciate ligament injury there is anterior draw test positive. Medial collateral ligament, in case of medial collateral ligament injury there is the positive valgus test positive. So these are the short information regarding the options.